Follow these steps for the first time use for each new Victoza pen. First, take your new Victoza pen out of the refrigerator. Wash your hands with soap and water before using it. Check the pen label before each use to make sure it is your Victoza pen. Pull off the pen cap. Check the Victoza in the cartridge. The liquid should be clear, colorless, and free of particles. If not, do not use. Wipe the rubber stopper with an alcohol swab. Remove the protective tab from the outer needle cap. Push the outer needle cap containing the needle straight onto the pen, then screw the needle onto the pen until it is secure. Carefully pull off the outer needle cap, but do not throw it away. Pull off the inner needle cap and throw it away. A small drop of liquid may appear. This is normal. Turn the dose selector until the flow check symbol lines up with the pointer. You only need to do this once for each new pen, and it is only required the first time you use a new pen. Hold the pen with the needle pointing up. Tap the cartridge gently with your finger a few times to bring any air bubbles to the top of the cartridge. Keep the needle pointing up and press the dose button until 0 milligrams lines up with the pointer. Repeat these steps up to 6 times until a drop of Victoza appears at the needle tip. If you still see no drop of Victoza, use a new pen and contact Novo Nordisk at 1-877-484-2869.
The individuals appearing in this program are not actors. They are real people who take Victoza, liraglutide rDNA origin injection. They share their own personal experiences. Your experience with Victoza may be different from theirs.
When it was first suggested by my doctor that I use an injectable, I was a little apprehensive and nervous because I had not used one before. However, they showed me in the doctor's office what it was like. It looked simple.
My doctor actually did a demonstration in his office where he showed me, a regular needle that you would give a regular injection with, and then he showed me the pen needle and kind of had me look at it and hold it in my hand to see how it worked and see how it looked and see how small the needle was. So that really calmed a lot of my fears.
After I injected myself with the first dose, I was relieved because I realized that it was something I could do, and it was not what I had expected.
It has big numbers, so it's easy to read. Even if you don't have your reading glasses on, you can still see the numbers. I went online and I was able to watch the video that again demoed how to use the pen. So that was a real simple process to watch, and I could follow those steps and do it myself.
Victoza, liraglutide rDNA origin injection, is an injectable prescription medicine that may improve blood sugar, glucose, in adults with type 2 diabetes when used along with diet and exercise. Victoza is not recommended as the first medication to treat diabetes. Victoza has not been studied in patients with history of inflammation of the pancreas, pancreatitis. Victoza is not a substitute for insulin and has not been studied in combination with prandial mealtime insulin. Victoza is not for people with type 1 diabetes or people with diabetic ketoacidosis. It is not known if Victoza is safe and effective in children. Victoza is not recommended for use in children. In animal studies, Victoza caused thyroid tumors, including thyroid cancer in some rats and mice. It is not known whether Victoza causes thyroid tumors or a type of thyroid cancer called medullary thyroid cancer, MTC, in people, which may be fatal if not detected and treated early. Do not use Victoza if you or any of your family members have a history of MTC, or if you have multiple endocrine neoplasia syndrome type 2, MEN2. While taking Victoza, tell your doctor if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. These may be symptoms of thyroid cancer. Do not use Victoza if you are allergic to liraglutide or any of the ingredients in Victoza. Serious allergic reactions can happen with Victoza. If symptoms of serious allergic reactions occur, stop taking Victoza and seek medical attention. Pancreatitis may be severe and lead to death. Before taking Victoza, tell your doctor if you have had pancreatitis, gallstones, a history of alcoholism, or high blood triglyceride levels, since these medical conditions can make you more likely to get pancreatitis. Stop taking Victoza and call your doctor right away if you have pain in your stomach area that is severe and will not go away, occurs with or without vomiting, or is felt going from your stomach area through to your back. These may be symptoms of pancreatitis. Before using Victoza, tell your doctor about all the medicines you take, especially sulfonylurea medicines or insulin, as taking them with Victoza may affect how each medicine works. If you use Victoza with insulin, you may give both injections in the same body area, for example, your stomach area, but not right next to each other. Also, tell your doctor if you have severe stomach problems, such as slowed emptying of your stomach, gastroparesis, or problems with digesting food. Have or have had kidney or liver problems, have any other medical conditions, or are pregnant or plan to become pregnant. Tell your doctor if you are breastfeeding or plan to breastfeed. It is unknown if Victoza will harm your unborn baby or if Victoza passes into your breast milk. Do not share your Victoza pen with other people, even if the needle has been changed. You may give other people a serious infection or get a serious infection from them. Your risk for getting hypoglycemia or low blood sugar is higher if you take Victoza with another medicine that can cause low blood sugar, such as a sulfonylurea or insulin. The dose of your sulfonylurea medicine or insulin may need to be lowered while taking Victoza. Victoza may cause nausea, vomiting, or diarrhea leading to dehydration, which may cause kidney failure. This can happen in people who have never had kidney problems before. Drinking plenty of fluids may reduce your chance of dehydration. The most common side effects with Victoza include headaches, nausea, and diarrhea. Nausea is most common when first starting Victoza, but decreases over time in most people. Immune system-related reactions, including hives, were more common in people treated with Victoza compared to people treated with other diabetes drugs in medical studies.
Oh my God, Janila.